The San Diego Business Journal is proud to present the 2021 Healthcare Heroes Awards. This being its first year, we are especially honored to feature some of San Diego's most respected behavioral healthcare experts within their respective fields. And now I'd like to introduce the San Diego Business Journal's president and publisher, Barb Chodas.
Welcome everyone to the San Diego Business Journal's 2021 Healthcare Heroes Award Ceremony. I'm Barb Chodas, president and publisher of the San Diego Business Journal. In a year defined by one of the biggest healthcare crises of modern times, we owe so much to the many healthcare workers who sacrificed and demonstrated incredible leadership, courage, and compassion in our community. We are humbled to be honoring these individuals who have contributed so much during these difficult times. In addition to recognizing our healthcare heroes and in honor of Mental Health Awareness Month, we will also be hearing from a panel of local healthcare leaders who will discuss the mental health care crisis in our community. The impact COVID-19 has had on San Diego businesses, their employees, and their families has been significant and challenging. This panel of mental health experts will provide us with insight, best practices, and available behavioral healthcare resources. Before we begin our program, I'd like to take a moment to thank our sponsors who made today's event possible. Please join me in thanking Kaiser Permanente, Mental Health Systems, Longfellow, Neighborhood Healthcare, and TrueCare. Now let's begin our program. It is my privilege to introduce the moderator for today's panel discussion, Cathryn Nicario from the National Alliance on Mental Illness, San Diego. Cathryn is the Chief Executive Officer. She is passionate and very dedicated to serving all those impacted by mental health challenges. Her fusion of nonprofit and for-profit work is an excellent combination for bringing business acumen and compassion together for business growth and prosperity. Her efforts are grounded in a desire to help and serve more individuals and their caregivers. Please join me in welcoming Cathryn Nicario.
Thank you, Barb. I am so honored to be here today moderating this event. Now, I would like to talk a little bit about what is a mental health disorder. So what's kind of happening today? 1 in 3 Americans have experienced a mental health concern in the past year. Previous statistics prior to 2020, that number was 1 in 5. So we're definitely seeing an escalation in mental health concerns and crisis over the past 14, 15 months. 40% of US adults are reported struggling with mental health or substance abuse disorders, and that's just as of June 2020. We're seeing a significant increase in substance misuse during this time, whether it be alcohol or drugs. Another interesting fact is the delay of treatment from up to 11 to 13 years. And what I mean by that is somebody may be experiencing some unusual signs and symptoms of a mental health concern. They're not quite sure what's going on, but they know something's a little bit off with themselves, but they don't know quite where to go. The delay for what we consider treatment services can be extraordinarily great. There's a giant gap. In about 13 years, it used to be 11 years, but now that number has increased from when you're first maybe not feeling quite yourself to when you're actually seeking treatment from a provider. And then 1 in 6 US youth ages 6 to 17 experience a mental health disorder each year. And I think that's an important statistic to look at. Our youth and our children are very much have experienced these types of signs and symptoms. We have to, as parents and caregivers, kind of try to decipher what's the difference between a kind of a normal childhood behavior or adolescence in particular, and what's really cause for concern. But many diagnoses are coming in at a younger age, especially over the past year. Next slide, please. So what is a mental illness? Let's understand mental illness a little bit. Mental illness is a condition that affects a person's thinking, feeling, or mood, and may affect somebody's ability to relate to others and function on a day-to-day basis. Each person has different experiences, and often people with the same diagnosis may experience different degrees of that diagnosis. So a mental illness is a medical condition of the brain. Mental health challenges, again, affect a person's ability to think, feel, and their mood. And often it is not the result of one event. Research is suggesting that there might be multiple overlapping events, such as genetics, environment, lifestyle influences, that really influence how somebody develops a mental health condition. A stressful experience in life can make people more susceptible to a mental illness, as do traumatic life events, like being the victim of a crime as well. Next slide, please. So what is a mental health condition? Again, it is a biological medical condition, very akin to, say, having high blood pressure or high cholesterol. It's an actual medical condition. It's often hard to diagnose because we can't see it, like a broken arm or psoriasis on your skin, something that's very, very visible. But it can be very silently suffering. It can happen to anyone at any age. Mental illness knows no demographic, geographic, boundaries whatsoever. It doesn't matter your social class, where you are with your economic environment. It knows no boundaries. But the important thing to remember is that they are treatable. Mental health disorders are very much treatable. And there are about 297 different diagnoses. And that's where we look at empathy versus sympathy. When we are either ourselves are working with a mental health diagnosis, or a family member or a loved one or somebody in our community, we can really empathize with that person when we learn that this is a true medical condition. There's also a significant amount of kind of disagreement about what are the identifiable causes of a mental health disorder. But there are biological factors, such as mental illness is more common in people whose birth family members often have a mental illness. It is something sometimes genetically passed down between generations. This genetic trait to developing a mental illness may be triggered by a life situation that actually caused the mental health illness to make itself visible if somebody's already at risk. There's also brain chemistry. Brain chemistry is known as the biochemical causes of a mental illness. Brain chemicals called neurotransmitters may play a role, and hormonal imbalances can also affect mental health. There are other forces that sometimes they can be linked to mental illness through brain changes, such as traumatic brain injury, or an injury to the brain from a blow to the head that interferes with our brain functioning. Also, exposure to viruses that can cause injury to the brain and its chemistry, exposure to toxins or poisons that may interfere with brain functioning. But the one thing to always remember is that recovery is possible. That includes having meaningful roles in your social life, in work, in school. And also, if you start treatment early and play a strong role in your own recovery process, the likelihood of you living a happy, healthy, productive life are increased exponentially. But it's really important to get that treatment early. Next slide, please. So what are the most common types of mental health disorders and mental illnesses? We kind of put them into 4 buckets, one being anxiety disorders, mood disorders, detachment disorders, and personality disorders. These are kind of the 4 common ones you will see in these buckets. But I'd like to go over some statistics with you so you understand the prevalence. Schizophrenia actually affects 11 in every 1,000 people. That's 2.4 million American adults, and that's 1.1% of all diagnoses of mental illness. Bipolar disorder, which we hear a lot about in particular, that's 26 in 1,000 Americans. That's 6.9 million adults here in the US. That's about 2.6 of all mental illness diagnoses. Then the numbers start getting greater. Depression. Depression is 69 out of 1,000 people. That's 16 million American adults who are suffering from a diagnosis of depression each year. That's 6.9%. And did you know that depression is actually #1 disability that's diagnosed by primary care physicians? So it's extraordinarily prevalent in our community in the United States and globally as well. And then anxiety, this is where the number really jumps. 18.1% of all mental illness diagnoses is anxiety. That's 181 people in 1,000. So 42 million Americans are living with a diagnosis of anxiety. So these are just a few statistics I wanted to share with you today, because if you walk into a room, the old stats were 1 in 5 people have experienced a mental health concern or a diagnosis in the past year. But due to the pandemic and the events over the past 14, 15 months, that number has now increased to 1 in 3. So it's our family members, our friends, our work colleagues, and people in our community. It is something that is so common, but often not talked about, highly stigmatized. Nobody wants to share, and whether for shame or embarrassment, but that's an old school way of thinking. We want to encourage everybody to please talk about it, seek treatment, share with your family and friends, because I guarantee somebody you know has experienced this either in themselves or in their family. Next slide, please. This is where it's important to really know what resources are available in our community. So there's a whole variety, especially if you have access to the internet, whether it be on your smartphone or your computer. But I wanted to share some local resources with you today. One being the San Diego Warm Line, which is a warm and caring listening presence, somebody ready to talk and ready to listen. And boy, I can tell you at NAMI San Diego, for our helpline, which is not a warm line, it's just a helpline resource line, in the first 3 months of the pandemic, we saw a 4-fold increase in the amount of calls that we were receiving into our helpline. Everything from needing mental health resources to housing resource, food insecurity, and some people that just needed to talk, especially in those early months where isolation was really prevalent and not being able to go out because of the shutdown, just hearing that warm, friendly voice. Of course, we have 911 where you can ask HURT, which is our psychiatric emergency response team for when someone is in crisis. We have our access and crisis line, which is here in San Diego at 724-7240. That's a 24/7, 365-day-a-year access and crisis line. Again, finding resources, and also if you're in active crisis or a family member that's in active crisis, they're able to be linked to a clinical provider almost immediately when calling that line. So it's a really valuable resource to have. And then finally, one of our newest resources in San Diego County, which is really exciting, it's up in our North Coastal region, is our mobile crisis response team. This is where you will have a clinician and a peer support specialist. And a peer support specialist is somebody with lived experience. They've walked this journey before and they're in recovery with their own mental health concern or a family member. And they will meet that person, provide clinical services, get them linked to resources, and provide follow-up in that really compassionate clinical way, as well as in that peer support way. So I just wanted to give a little overview, kind of what is mental illness all about, and some resources that are available for you today. So now I am so excited to introduce our great panel of behavioral health experts, representing some of the most well-established behavioral health facilities in San Diego. Each panelist will be given an allotted window of time to present. We will then follow up with a general Q&A session at the end of the program. Now it's time to introduce today's sponsors and panelists. Our first sponsor today is Kaiser Permanente.
Hi, I'm Rodarte, Senior Director of Public Affairs and Communications for Kaiser Permanente here in San Diego County. On behalf of Kaiser Permanente's nearly 10,000 employees and more than 1,400 physicians, I'd like to thank the San Diego Business Journal for inviting us to participate in today's very important event. Healthcare professionals from across the county work tirelessly, 365 days a year, to care for San Diegans. Never has their commitment and dedication been more apparent than throughout this COVID-19 pandemic, and we are truly grateful to be here today to celebrate them. Kaiser Permanente serves nearly 1 in 5 San Diegans. We operate from 30 facilities across San Diego County, including 2 acute care hospitals, and we also have 5 target clinics throughout the county as well. We're pleased to announce that we're opening our 3rd medical center in the city of San Marcos in the fall of 2023. In the meantime, We thank you for being here, and we invite you to join us in celebrating the healthcare workers in San Diego County. Thank you.
Please help me welcome our first panelist today, Yvette Aguayo. She is manager of Kaiser Permanente's Otay Mesa Psychiatric Clinic. Yvette began her career with Kaiser Permanente in 2013 and brings 20 years of behavioral healthcare experience to her current role. Yvette has hosted a region-wide training of behavioral health interventions for first responders during COVID, training more than 300 mental health professionals. Yvette is a San Diego native and prides herself in keeping her community safe. Please welcome Yvette Aguayo.
Yes, hi, good morning. Thank you for having me. I'm here today to talk about mental health impacting our workforce during the time of COVID. And as a San Diego native, I'm extremely happy and proud to see that our places of employment are opening up and they're back in operation. As we're getting back into business, it's essential that we maintain a sense of safety for our employees. Openly demonstrating COVID-related protocols for your business, such as masking, social distancing properly, making sure that we're cleaning and keeping our work areas and workstations sanitized will be very helpful in keeping the anxiety of your workforce at bay. Please be flexible with remote working. Our employees can do several of their tasks and jobs from home, and this is actually been very helpful during the time of COVID. Right now, it's pretty essential that we express a sense of empathy and understanding. Some of our workers simply want to be heard and validated for the experience that they have been experiencing at home. You can utilize your company resources, remind employees to take advantage of EAP, the Employment Assistance Program, encourage them to schedule vacation time, even if they're not going anywhere. Planned time off is really essential with maintaining good self-care. All in all, maintaining a sense of normalcy will help lower the impact of opening the businesses and being surrounded by more people. If I can see the next slide. I wanted to take a moment to distinguish between certain essential businesses. We have our workforce, in the food industry, agriculture, energy workers, and all of those are very essential. And I'm happy and pleased to see that we're back up and running. But there is a group of essential workforce that I would like to talk about, and those are the mental health clinicians themselves and first responders. For these companies that have those types of employees, it's critical that you understand that your employees may be experiencing secondhand trauma themselves. They're listening to stories from people who have been exposed to COVID. They have been traumatized themselves, and they're often listened to these stories with great emotional detail. This workforce, the mental health clinicians and first responders, they're physically seeing the public. Sometimes they're touching them, they're helping them. Police officers, firefighters, they're helping the victims. Mental health clinicians are helping the patients. So in addition, they're writing reports, they're taking notes. And so reading those notes and documentations can actually trigger the employee themselves, often from their own past trauma. Counselors that are actually providing therapy to first responders are also unique during this time. They're listening to first responders' accounts of critical incidents that take place in the community. And during this time, very impactful. First responders are facing a lot of critical situations with our social impact. Right now, it's essential to be aware of employees' sudden or drastic change of behavior. If their performance is poor and they've typically been a good employee, that might be something that you might want to pull your employee in and kind of investigate and ask them how they're doing right now. Also, if there's more complaints about that employee and they were typically a good performer, sudden changes in their behavior are something to be looked at. And lastly, it's important to remember that these are workforce that are exposed not only to the public, as all essential businesses are, but that they are actually helping those that have been in critical incidents or traumatized during this time.
Yvette, what are the most critical changes that we must make in the current mental health care system to face the future effectively?
Yes. Well, first we need to continue to foster and build a culture of inclusivity and equity, as we have races and ethnicities who've been disproportionately impacted by the pandemic. Also, we should advocate for and implement an integrated care approach to behavioral health. This is no longer simply a psychiatric issue. At Kaiser Permanente, we have multiple departments assisting in behavioral health. Patients suffering from postpartum are often referred by OBGYN, and patients exhibiting depression and anxiety are often first diagnosed by their primary care physician. Pediatrics refers children with severe body mass index scores for obesity to our CATCH program, where nutrition, medical, and mental services are offered. The Center of Healthy Living at Kaiser Permanente has expanded their services to include biofeedback, meditation, also mindfulness. So expanding this approach into additional areas of medicine will help improve our ability to identify and treat behavioral health issues early on, thereby improving the lives of those we care for.
Thank you so much, Yvette. I really appreciate the way you put in the cultural perspective as well as a holistic approach. That's what we really enforce at NAMI San Diego, is that we treat the whole patient, the whole client, from their cultural perspective, from a medical perspective, a clinical perspective, as well as a holistic perspective. So thank you so much for mentioning that. And we have one more question for you today. How are you addressing the mental health and well-being of your employees and the population that you serve during these unprecedented times?
Yes, employee safety and wellness is our top priority. So at the onset of the pandemic, more than 50% of the workforce transitioned to working remotely. We maintained a sense of normalcy and team spirit by using virtual platforms for our team's meetings. We encouraged chat rooms amongst the employees so that they could create a mode of communication and support to one another. Kaiser Permanente's Department of Psychiatry and Addiction Medicine suffered 0 layoffs. We're really proud of that. And we were able to actually hire additional mental health clinicians due to open office space. So because of the employees working from home. With equal energy, we focused on the safety and mental well-being of our patients during the pandemic. One example was a virtual on-duty team was created to meet the urgent crisis needs of our patients, as well as providing the latest innovative therapy modalities. Some of them such as Calm, the Calm app, and My Strength app.
Thank you so much. I can only imagine what a giant lift that was for Kaiser Permanente to move so many people remote and provide that level of support to their employees and staff as well. Thank you so much for your insights and perspectives today. We really appreciate your time.
Thank you.
Our next sponsor today is Mental Health Systems.
I'm so proud and honored to be the CEO and president of Mental Health Systems. It's times like these where I have the good fortune to honor the hardworking heroes at MHS and share with you their amazing character and tireless efforts that they give each day. Our employees jumped in and provide crisis stabilization and reassuring counseling at the San Diego Convention Center temporary shelter. While others were sheltered in place during this amazing COVID crisis, ours were on the front lines every day without skipping a beat. I would also like to thank the San Diego Business Journal for hosting the Healthcare Heroes, where we can shine the spotlight on our MHS dedicated employees. On behalf of MHS, Thank you very much.
It is my great pleasure to introduce our next panelist, Mental Health Systems Chief Operating Officer, Dr. Wendy Broten. Dr. Broten has been with Mental Health Systems for over 20 years. Her passionate dedication to improving the lives of individuals, families, and communities through ensuring client-centered clinical services is really inspiring. She has personally mentored more than hundreds of counselors, leaders, and line staff alike, and is a champion for those with lived experience who are giving back to their community. She is committed to focusing on the guiding principles of people, culture, and growth of mental health systems.
Thank you, Cathryn. I appreciate that. I want to thank the San Diego Business Journal for hosting this event, and I'm honored to represent mental health systems. So if you will cue up the first slide, please. We'll get to it. Okay, so ensuring the mental health and well-being of your employees. It's really important to normalize mental health discussions and the experience of emotional highs and lows. It's perfectly normal right now. Past trauma also plays a part in how individuals will respond and their individual levels of resilience. So you want to be able to provide enough space and understanding for these experiences. More than ever, people have these heightened levels of anxiety. There's a lot of uncertainty right now. There's more isolation than folks are used to, not able to engage in the recreational things that, or family time that people normally would. So there's this little bit of buildup for folks. So we have to be able to create some space and understanding for that. In terms of a stigma-free environment, it's important that you consistently communicate to employees that seeking help is a sign of strength and not a weakness, and that your organization supports them, that they're not alone. You can host listening sessions, you can have guest speakers, people with lived experience come in and talk about it, and also provide training about mental illness. It's really important to emphasize that it's okay to talk about. This shouldn't be hushed conversations in the hallway. We have to be able to talk about these stressors the way we would anything else. In terms of making help accessible, you want to go beyond just talking about making help available for your staff. You want to help facilitate when issues arise, walk them through the whole process. Make sure that you're certain that they've got the help that they need and that they're okay. It's only help if it feels like help. While EAP is important, and I don't want to minimize that, it's also not enough to just give a referral. You know, this is a time when people need to know that you're in their corner. In terms of training for signs and symptoms, a critical step in creating a supportive culture around mental health is to properly train your leaders to recognize signs of mental illness, excessive workplace stress, and burnout. You know, it's people maybe who aren't showing up with the regularity that they used to. Maybe they're short. Maybe you could just tell they don't have the level of energy that they would normally have when they come into the office. Something is off. Go ahead and provide a platform, provide space for that person to be able to talk openly about what's going on. Okay, next slide, please. In terms of your own self-care, we've heard the old adage, you have to put your own oxygen mask on first, and that is super true with this. So when we talk about ourselves, boundaries and routines, set boundaries. Even though it's hard to create workspace at home with the competing demands of being an employee, a parent, a homeschool teacher, all in one, we've all had to face that. It's still important to normalize this. Rituals can help. They can help to reinforce the boundaries between work and home, like a sign on the door. And even better, if you have kids at home, and that makes it a little challenging, to be able to focus on your meetings and kids in the background, but have them go ahead and help make a sign, make, something that they can create and have buy-in. They get to put that on the door, and that they know they set the alarm for 5 o'clock. And when 5 o'clock rolls around, they get to pull that sign off the door. And that's your cue that it's family time. Communication and connection. Talk about how you feel. It's really okay. We have to role model as leaders. We have to give permission to our employees. We all need compassion and understanding during these uncertain times. Moreover, we need connection and to know that we're not alone. We all struggle with the work-life balance, taking care of work responsibilities and then being present for those we love. And sometimes those can painfully compete with each other, or sometimes we have incredible guilt around making one decision over the other. But you don't need to minimize or apologize for being human. And then break time. Okay, so taking breaks is really important. Push back from the desk, stand up, stretch your legs. This goes for whether you're in the office or working remotely at home. And for the multitaskers out there, I'm speaking to my people right now. It doesn't mean that you push away from the desk and answer voicemails, check text messages, or if you're working remotely, go do a load of laundry or take care of the dishes. It means just rest, recharge. We underestimate the value that can happen when we just pause. And then the last piece here is, that the health trilogy we hear about: nutrition, exercise, and sleep. Proper nutrition consists more than a Starbucks. And I know that's a surprise for some of us who live on caffeine, but truly, when these are really draining times for us right now, we have to give our bodies a little bit better sustenance. Adequate exercise, there's a double benefit here. Not only do we feel better cardiovascularly, but endorphins are released, and that can really have an effect on our attitude. It can really improve how we see and experience life around us, which makes us better for those people depending on us. And then in terms of sleep, there is no substitute for quality sleep. I know people around me know when I'm cranky, and chances are they know when you're cranky. So you have to have that rest and relaxation. We give so much. We give 110% when we're at work. And so, and then many of us, we then have our families and we give 110% there. And we know there's not that much of us to give. So it's really important to replenish. And then let's say you've taken care of all of these areas and you're still feeling off. And it's not just a bad day. You're really feeling like something's wrong. Don't be ashamed. Don't have any reservations about. Maybe just see your primary care physician and they can assess for other considerations. Maybe there's other things going on, but either way, you get the support that you need, and more importantly, you get the support that you deserve.
Thank you so much, Dr. Broten. I can't tell you how helpful it is kind of going back to basics and hearing proper sleep, proper nutrition, taking those breaks. I loved your thoughts about multitasking, because boy, are we all guilty of that, especially in the day and age of Zoom and team meetings. It just seems like it's one right after the other. So scheduling in those break times are so vitally important to our mental health. So just have a minute to reflect and recharge, as you mentioned. So I've got a quick question for you. I got a couple of questions for you, actually. How can we help staff with that work-life balance and to avoid that burnout? I know you gave several great examples. Were there anything really specific that we can tell our staff to make sure that they're not going to have that burnout that many of us are experiencing these days?
Yeah, great question. So, good self-care is essential. It's hard. It's hard with the COVID stress, and we're wearing multiple hats. So acknowledging that. You have to acknowledge the difficulty. Zoom fatigue is real. We sit for hours in front of the screen, often into the night. So we need to take breaks. And more importantly, which we haven't mentioned yet, remember to laugh. There are good things going on. Even though it feels so heavy, there's still things, share a belly laugh with someone. It feels good in it. And it reminds us of the reason we do this work to begin with. And remember, there's no playbook for this. But rituals to begin and end the day, that can really help to ensure the quality of work is there, but we're also preserving uninterrupted family time. And remember, no one has to do this alone. It's okay to ask for help. We should be asking each other for help. And it's really the connection with each other that matters. I say this all the time at mental health systems, that, if we put people first, we can't go wrong.
Absolutely. It's creating that stigma-free environment to where we know it's okay to reach out and make those connections and just say, hey, you know what? I'm not doing so well today. And that's okay. And that's okay. So how can we help build a little bit more resilience in the face of such stress and uncertainty?
Yeah, great. In large part, it will depend on how you went into COVID. Did you get enough sleep, exercise, time in nature, and again, laughter. Employees are taking less time off than usual due to COVID, but even long weekends, short getaways can make all the difference and help build those reserves and provide a fresh perspective. Don't underestimate that recharging that can come from just stepping away. Don't forget, walk outside, get some vitamin D. We're surrounded by, air conditioning and fluorescent lights and, air, the hum, so just getting out in nature can make a big difference. Also, carve out time for reflection and gratitude. It really can help the way that we want to move forward in this new normal. We talk about the new normal, but we get to decide how we step into that and who we want to be. And so just being okay with the experience unfolding. Here's the thing, we don't have to know today. We just have to show up, have some courage, walk through it, lean on each other, be present, and remember we're in it together. And this is a great example. This forum is a great example so we can normalize these experiences. If we really want our workforce to perform and be happy at work, then these are the things we have to talk about. So thank you.
You're welcome. Sometimes it's just taking that deep breath, and a few deep breaths and counting to 10 and just resetting yourself. Thank you so much, Dr. Broten. Those are awesome suggestions, something we should all abide by, and hopefully those watching today will start putting some of these into practice if they haven't already. Thanks so much for being with us.
Thank you.
Our next sponsor today is Neighborhood Healthcare.
Hi, I'm Dr. Jim Schultz. I'm the Chief Medical Officer at Neighborhood Healthcare. We're a community health center with locations in San Diego and Riverside counties, and through the COVID pandemic, we managed to continue caring for over 75,000 patients with more than 350,000 visits. We're really happy to be sponsoring the San Diego Business Journal Healthcare Heroes Award and the Round Table. We put up some great nominees who have, throughout the COVID pandemic, showed their courage, their bravery, their willingness to work, and their dedication to taking care of our patients in our community. Our staff has been tremendous. They've faced COVID head-on, dealing directly with patients and putting systems and procedures in place to make sure our patients always had access during this very serious time. We're so happy you're helping us honor these folks, and we honor all the rest of the nominees today.
Please help me welcome Dr. Gabriel Rodarte, Behavioral Health Medical Director. Dr. Rodardi has an amazing amount of experience behind him. He is triple board certified in family medicine, psychiatry, and addiction medicine. Dr. Rodardi graduated from the University of California, San Francisco School of Medicine in 2002 after completing his undergraduate degree at Harvard University. He joined Neighborhood Healthcare in 2007 after graduating from the combined family medicine and psychiatry residency program at UCSD with an emphasis on addiction disorders. San Diego County Medical Society also named him top doctor in psychiatry for 8 consecutive years. Please help me welcome Dr. Rodardi.
Hi, great. Thank you, Cathryn, for that kind introduction. And thank you to the San Diego Business Journal for having me today. So a little bit about Neighborhood. We are a private nonprofit, federally qualified health center that spans throughout Eastern, Central, and North San Diego County and Riverside counties, providing full spectrum primary care, along with a lot of other services, including podiatry and dental, and then of course behavioral health services as well, which I'm the medical director for, where we integrate services into our primary care services. Let's go ahead and move on to the next slide. So this slide just shows the number of visits. That's total number of visits for all of neighborhood healthcare, including all types of services for the last year. But I think the interesting thing here is that our behavioral health visits were almost 50,000 this year, which is a record for us. We've never had that many visits in a year, and it's 35% over the year prior. I was to show the need right now for behavioral health services, and we're attempting to meet that need by increasing our access and services. Let's go ahead and move on to the next slide. So this is just, I think it speaks for itself, our mission to improve the health and happiness of our communities we serve by providing quality care to all, regardless of situation or circumstance. In behavioral health, we do that by trying to integrate our behavioral health services into all services that we provide at the organization so that people can access behavioral health services regardless of where they interact with us, providing services to all. So let's move on to the next slide. So, at this point, so access to care is more than just health care. So we're noticing with COVID, we had a significant change in our delivery of care. We had to pivot quickly to providing virtual services. Prior to that, we did really only in-person services in behavioral health. And then after COVID, we were doing a majority of actually virtual services. And what we noticed with that was really interesting, that we had a tremendous decrease in our no-show rate. We went from having sometimes no-show rates for our visits in behavioral health of 30 to 40% to going down to really hardly any no-shows anymore when we were able to call and connect with people virtually. And I think that just goes to show that there were significant barriers to care with our old model for our population. And so now, being able to interface with people using the telephone or video visits, it's just opened up a whole new world of services that we can provide to our patients, and allowed me to connect with patients that in the past I had real difficulty managing, to be honest, because I couldn't always connect with them. And this way, it's so much easier to connect with those patients. And so in that vein, in order to provide good quality services, we've been utilizing more mobile services as well. So we now have cars, vans, mobile teams that can go out to homes to get vital signs, to draw blood, to do EKGs, so that we can really make sure that we're providing the best care that we can to our patients while providing these virtual visits. So let's go to the next slide. So looking forward to the future, we plan to continue to hopefully be able to continue to offer these virtual services, and I think we will be able to, and make it so that we can actually provide the best of both worlds, be able to provide in-person visits when people want that, but also be able to provide virtual visits when needed, and then being able to connect with people in their homes if needed, to be able to provide services so that people do not fall through the cracks like they used to in care. And so I'm actually really excited about that moving forward.
Thank you so much, Dr. Rodarte. I want to reflect upon the 35% increase in behavioral health services that you've experienced over the past year. I know I mentioned earlier in my presentation, our kind of former statistics were 1 in 5 individuals have experienced a mental health crisis in any given year. And after 2020, those numbers are now 1 in 3. So it really mirrors what you're experiencing at neighborhood healthcare as well. And I love the fact that you've recognized that reducing barriers, such as requiring an in-person visit at the clinic, has really been helpful. The use of phone consults and telehealth, I really do believe, has expanded our ability to reach more individuals and provide much needed services. So thank you for all the work that you're doing on that. So now we're going to shift a little bit to our first question with you, Dr. Rodarte, is how does neighborhood healthcare plan to respond to the mental health challenges of our students?
Yeah, that's a good question. So, and I didn't really touch on it earlier. So basically, I want to reflect on what you were saying too, that what we're also seeing in surveys is that, there's a fourfold increase since the COVID pandemic in depression and anxiety symptoms in the general population. And actually, one of the hardest hit populations for that is our young adults and teens. And so we're seeing this in the clinics. And so we really feel we need to reach out and we need to be more proactive in connecting with those patients. And so we're looking at all possible options, including partnering with schools. We're looking at potentially trying to have mobile services that will actually go out to schools to provide services at schools. Really looking at any location where we can find young adults and teens and interface with them. And that would include virtually, like I was saying before, using virtual technology with kids actually can be not that hard. They're actually quite savvy, with technology. And we want to kind of leverage that and be able to use technology to connect with children in our communities and provide the support services. What I've been finding actually that I'm really excited about is that it does seem like the younger generation is much more knowledgeable and accepting of the idea of having depression, of having anxiety. And it seems like the stigma is not as strong for younger people as it is for older generations. And so that's exciting to me, and it makes me hope that we can actually decrease stigma further and actually connect with these patients and provide them the services that they need.
I absolutely agree with you. When I speak with colleagues and friends who have children, ages basically 14 to 20, 22, there is a greater sense of openness in discussing feelings and emotions and supporting one another that is starting to reduce that stigma. So I'm glad you're seeing that as well. Let's switch a little bit to substance use, since that is one of your specialties, is addiction disorders. We have all been reading that as a result of COVID, there are much higher rates of substance use. What are neighborhoods' plans in helping to address this issue for our community?
Yeah, it's a real problem. And I worry a lot because, we were in the middle of an opioid epidemic, prior to COVID, where we were seeing, and actually we were just seeing some improvements in that, in decreases in overdoses in some of our communities. I'm scared to see what the numbers are going to show now, now that since COVID, and we're already seeing increases in overdose deaths and drug use in our communities. So we definitely need to address that. And what we've been doing is I actually recently became addiction medicine board certified. And so to kind of be able to provide more of those services to my patients, we actually recently hired an addiction psychiatrist. He'll be starting in the summers to be able to provide more services to our patients. But more importantly, having that support is really important. But even more importantly, I think, is doing the proper screening within all of our services so that we kind of identify people that are struggling in these areas and reaching out to those patients and making sure that we can get them in to get services, and also making sure that all of our primary care providers have some knowledge and feeling confident in their ability to address these issues and talk about these issues, because that's oftentimes one of the big barriers, is that our providers don't know how to talk about this with their patients, and they feel uncomfortable about it, and they feel a stigma associated with it, so they don't do it. But we can't do that any longer. We need to talk about this. We need to decrease the stigma. We talk about the stigma with mental health. It's even worse with addictions and medicine. Oftentimes it's seen as a moral failing, which it just isn't. This is a biologic condition that needs to be treated, and we're seeing that more and more in the research that we do on this. So we need to really decrease that stigma. We need people to access services, and we need to have the services available. And so we're working towards all of those things to try to be able to make sure that we can address the need when it comes up.
Absolutely. I know many of us in this field are really well entrenched in the co-occurring world. So sometimes you may have a serious mental illness and addiction disorder, and many times we don't know which came first, the chicken or the egg on this, which triggered what. And we always like to say at NAMI San Diego, it's almost to be expected versus the exception to the rule, that you're going to have that co-occurring type of disorder that you're working with our clients and our families, and especially our family members who really need a lot of support and knowing how to, some tips and tools to work with their family members during a very, very difficult time. Dr. Rodardi, thank you so much for not only touching on the mental health of our students and our families, but again, the so important role of addiction, how it plays in our mental health as well. Thank you so much for your time today and those really amazing insights that you've given us.
Thank you. Take care.
Next up, we have our final sponsor, TrueCare.
Good afternoon. I'm Michelle Gonzalez, President and CEO of TrueCare, formerly known as North County Health Services. I want to thank the San Diego Business Journal for inviting us to take part in the Healthcare Heroes event. As we all know, COVID-19 has challenged every aspect of our unique worlds, including our overall well-being and in particular our mental health. At TrueCare, we've seen firsthand the critical need for behavioral health services, and we know that need only continues to grow. That's why at TrueCare, our doors are open to everyone. With 11 state-of-the-art health centers and a compassionate workforce that is comprised of more than 600 physicians, advanced practice practitioners, and support staff, we are honored to offer heartfelt care to nearly 60,000 individuals annually in North San Diego County and Riverside counties. I'm also proud to share that later this spring, we'll be rolling out our new mobile wellness unit, where we'll deliver medical and dental services, COVID testing, vaccines, and so much more. We look forward to our continued efforts working alongside many of you in achieving greater health equity for all. Finally, thank you again to the San Diego Business Journal for allowing TrueCare to take part in this important celebration of recognizing the many healthcare heroes throughout our region.
It is my distinct pleasure to introduce our final panelist, TrueCare's Dr. Shayna Walker, board certified, member of the NCMS, member of the AMP, and member of the APA. Dr. Walker has spent the last 14 years supporting and guiding individuals battling with mental health issues. She graduated from Albert Einstein College of Medicine of Yeshiva University Medical School in 2007 and started at TrueCare in 2013. Welcome, Dr. Walker.
Thank you so much, Cathryn. Appreciate being here. We are excited to celebrate our healthcare heroes. So thank you for the San Diego Business Journal for this awards and recognition for our true heroes in healthcare. There's been lots of highs and lots of lows, but some good things that have come from this year is our ability to connect with patients using telehealth. At TrueCare, we've been using telehealth to connect with patients for about 4 or 5 years prior to the pandemic. And with the pandemic that occurred, it was a rapid shift to pretty much 100% telehealth services. Throughout the country and the world, psychiatry, mental health providers have seen 3/4 to near 100% of their patients using telehealth means. Patients are keeping their appointments and staying connected by seeing their providers on a virtual telephone or virtual video conference. We just love that ability to kind of connect with them using technology. Patients love it. I have patients who are everywhere around the world, it seems like, but they can still have their visit. They can still connect with me because we don't have to be limited by the 4 walls of an office building. Some patients, however, do not have the ability for video conferencing or other types of conferencing. So old-fashioned telephone still works. And I have patients who, sometimes I've never even met them in person, but we've been taking care of them for over the year, and they are benefiting from telehealth services. So we're excited to see this grow and continue for, I hope, for the rest of medicine. It's been around for a while, but as we see now, it's just super, super beneficial for patient care. Next slide. I don't want to proceed without kind of citing some of the concerns that we're having within our field. Our providers, our staff, our support staff, our medical receptionists, the whole kind of environment in healthcare, they are being affected with burnout. It's really concerning because we love what we do. I think no one goes into mental health or healthcare without just because they love what they do. And burnout is a big deal that we want to kind of make sure that we're addressing it, acknowledging it, and also making changes to improve it and provide solutions. Every workplace should focus on their employee and want their employee to be whole and well, and really focus on ways to decrease stress, to improve workflow, so that way patients and the team that's taking care of patients can be at their optimal and feel the best. We are extremely resilient people everywhere, and it's amazing to me to see how our staff and our patients are just thriving through the pandemic. Even though it's been a very, very difficult year, people are very resilient and we're excited for the future. But we do want to, highlight that burnout is a real thing. So you have to take steps to improve how you work, how you live, how you take care of yourself. So that way we lose, valuable people who are taking care of patients, especially who are mental health providers.
Thank you so much, Dr. Walker. I love how you actually have a similar experience as Dr. Rodardi there. Most of your patients are actually keeping their appointments, and your no-show rates are significantly lower than they were prior to the pandemic. So there are some good things that has come out of this past 14, 15 months that we've been experiencing. And the fact that you recognize there still is a technology divide in many of our communities, especially our most vulnerable populations that don't have access to adequate internet services. And we seem to sometimes forget that because it's something that we live with and we think is the norm of every day, but some folks do not have that ability to either afford it or even have it in their area where it's a proper bandwidth and you're able to do that telehealth. So that good old telephone is the way to go. So thank you so much, Dr. Walker. And Dr. Walker, we a lot of times focus on the clients. Well, what are a couple of key things that you can talk to us for caregivers? Somebody's a caregiver, somebody's suffering from a mental health disorder. What are a couple of tips and tools that we can have in our skill set to help their loved ones?
Absolutely. I love when I have a client come in and they have a family member with them. It's like a win in my book, because I know that there's people who are just as dedicated to taking care of the patient as I am, who care for them, who want them to be active functioning, and that could be in school, that can be at work, that can be just taking care of their kids, which is a huge responsibility. So the caregivers are vitally important in anyone's life, especially a patient who's suffering from a mental illness. So the caregivers, if they can be as supportive as possible, it's a lot of stigma with having any type of mental illness, and I think that's getting better, but it's still there. So I think having a family member and friends and loved ones who are encouraging and saying, hey, did you go see your doctor? Or also, hey, I'm here with you to talk about some of the hard things that come up. I think it's important that family members are there and helpful, because sometimes it's hard to recognize the early signs of when depression is starting or when anxiety disorders are starting. So it's really difficult for someone to see that on the inside out or outside in. So you need some feedback from your family and your friends, and that can help the whole clinical team so we can get to the best optimal place so that patients are feeling better, the teams are feeling better. It really literally takes a village to get folks to their optimal place of wellness.
It absolutely does. And boy, that family caregiver support is really key to successful recovery in living with a mental health disorder, as well as the self-care for the caregiver or the family member themselves. Oftentimes, it can be very, very exhausting to be a family member or a caregiver. So when they come in with you, I'm sure you always remind how important it is for them to take care of themselves as well, so they can also be mentally healthy for their own well-being as well as for their family member or for caregiving for. So what are small changes we can do every day just to improve our mental wellness? Just little things we can do every day.
Absolutely. I think it's little things. We celebrate the small wins. So, I think even a 5-minute dance break or listen to your favorite story or book or movie or show, the small things that can give you joy and peace, those are things that we need to highlight and focus on. It doesn't have to be the big, humongous things. It doesn't have to be a huge trip. It might be a trip to the park. It might be, going out in nature and exploring just, outdoors, which I think we're exploring more and more now because of the limitations for a lot of the places due to the pandemic. Scheduling it in sometimes if it's not on our calendar, it doesn't happen. So if you have to write down, this is my time to have game night, or this is my date night, or this is whatever night, we need to take care of our wellness. It's super important to do it every day. I know we're celebrating our Mental Health Awareness Month, but I think it's Mental Health Awareness Day every day, to take good care of yourself. Sometimes it's every hour or every minute. So we remind ourselves to take a step back, take a break, take time off. I just salute all of the mental health providers, all the primary care providers. They do an extraordinary amount of work. And sometimes we have to shake them to say, take care of yourself, and you can't give it all because you need to step back and take those breaks for yourself. So I salute all the heroes in healthcare.
Absolutely. And many times it's a reminder to be as kind to yourself as you are to others, because we often forget that piece. Thank you so much, Dr. Walker. We appreciate your presentation today and all the great tips and tools that we can kind of put in our tool belts and use as we move forward. Thank you so much for being with us.
Thank you.
Now it's time to welcome our entire panel of experts for a final Q&A session. So we just have a couple questions for you today, and please feel free to jump in and answer at any time. First off is, moving forward post-pandemic, what changes are your organizations making to support the mental health needs of your employees? Basically, what are you going to do differently moving forward than you did in the past?
Well, I'll jump in. So at Mental Health Systems, we, we're really trying to take it at the individual level. So really consider individual needs, not make blanket assumptions. It's very important that folks feel like they're heard. Some folks need a hybrid work environment, right? They need to be in the office part of the time and only during certain hours. And then they need to be at home during certain times and working remote there, and making sure they have the technology support that they need from their home. So, it's a seamless work environment. Productivity doesn't suffer, but they also feel like we're providing them the individual considerations and frequent communication. We've done a lot of town halls. So really just keeping communication flow open, reminding people that self-care is hugely important. I know we've talked a lot about that, but I think we could say it again. We have so many people who have accrued so much vacation time during COVID, because who wants to take time off and go nowhere? So, but folks have to be able to, kind of take a deep breath before they step back in the flow. So really, even just scheduling something and having it to look forward to. So we're just kind of emphasizing those things as we move back into this new norm.
Thanks so much, Dr. Broten. And for those who are in the clinic setting, is there anything that you're doing a little differently now than you did pre-pandemic?
Sure, if I can jump in. At Kaiser Permanente, we are expanding our staffing. So most recently, we just posted 16 positions of clinicians. We're also taking into consideration the hybrid position, such as Dr. Broughton talked about, where part of our staff works at home. Sometimes they'll come in a couple of days during the week in the clinic. And then we have some that are purely working from home. So we're just adapting to the norm. Again, staffing had to increase because of the very small no-show rate. So our mental health clinicians are working twice as hard.
Excellent. I love that Kaiser Permanente, again, is seeing exactly what Dr. Walker and Dr. Rodardi are seeing with those really low no-show rates, which is wonderful that people are actually accessing the services that they need. All right, another quick question. We're hearing, go ahead, Dr. Rodarte.
I was going to say that we also noticed significant provider burnout levels early in COVID, and have been taking a lot of steps to aggressively survey our staff, regularly about what's going right, what's going wrong, and really trying to aggressively make changes to improve people's situation, and trying to be flexible, as everybody's mentioned. I think is really important with that. And then actually, we something we didn't do enough of before that we're doing a lot more now is utilizing our behavioral health providers to support our staff as well. And you know, they just actually, you know, May is Mental Health Month. I'm sure everybody's aware of, and so we had a big thing for Mental Health Month where we've, you know, have a wellness calendar where every day of the month there's something that's suggested to our staff, you know, they can do for their wellness, and that was all done by one of our behavioral health consultants, you know. And so I think we're really trying to tap into that expertise more than we have in the past.
Thank you so much. Any final comments for that question?
I think I'll just echo.
A little bit similar. Go ahead.
Sure. I just wanted to echo all the team. I think we're just going to be nimble and flexible as we move forward. Every day and month is going to just shift and change. So we're going to keep adjusting. I think being stagnant is not the thing of the future.
Isn't that the truth? Being dynamic is truly key these days. And that's where a little bit our second question really kind of touches on the same topic. We're finding that our community is relaying to us that the reopening and re-entry is even more stressful than the quick shutdown that we all experienced. And many of you already have talked about the strategies that you're deploying in your own organizations. And I want to touch on a bit from what Dr. Rodardi said, and in particular about increasing employee wellness programs. Are many of you, I know Kaiser Permanente, you guys are so large in particular, I'm sure you have a very robust employee wellness program, but are you doing any changes to those programs to assist your employees?
Yes, actually, we are expanding. A lot of our departments are expanding their wellness services that they provide. So many of the departments that have already been established, they're increasing some of their classes or their trainings. The Center for Healthy Living, I can't talk, you know, enough about it. They have biofeedback and mindfulness teachings. And so what that has done is it's afforded the psychiatry department to provide even more mental health services. In addition, we're also providing better urgent care services. So just an expansion of everything.
Thank you.
Yeah, and at mental health systems, we're doing something very similar in that, you know, we talk about time and making sure people take the time that they need so that they can be present. And so we actually encourage people, go ahead and put that on your calendar. No shame. You don't have to hide the blocked time on your Outlook and call it something different. You can actually put on your Outlook calendar self-care time, meditation time, walk time, ride my bike time, you know, whatever it is, but go ahead and save that. We have to make it okay and not this, you know, hidden secret that we have to care for ourselves. You know, we can't wait if we wait till after 5 o'clock, it's not going to happen because our kids are going to get us at 5 o'clock. Our dogs are going to get us at 5:30, whatever. And before you know it, it's 9 o'clock at night before we've realized we haven't filled our own cup. So just acknowledging that and making sure we're carving it into our workday.
I really love that. So I hope your senior leadership is modeling that in their calendars as well. I know you will be, Dr. Broten, that's for sure. But I hope other senior leaders and supervisors and managers are actually setting that example and putting that in their calendars as going for a walk, taking a quick bike ride, gonna hit the gym for a little bit, you know, I'm gonna go sit on the couch for a little bit, whatever that may look like to somebody. So that's really, really awesome.
Yeah, for sure. I will say, you know, just to speak about that for a moment, our CEO that we have, Jim Callahan, he actually role modeled this first. So I'd love to take credit, but he actually role modeled it first and he put it on his calendar. And you're right, because what that did is it gave me permission to put it on my calendar. Then my folks see it and so forth. And this is cascading permission throughout the agency to take care of our mental health, our physical health, our spiritual health, you know, just to be able to be present for one another, right? So thank you for making that connection.
I'll just jump in. Another thing I think because we've also seen some anxiety with returning to the office. And I think, you know, what we feel is really important to make sure that we're doing everything we can to to protect our providers and our staff, and so, and making sure that the staff understands that, and so, and I think there's a lot of misinformation out there about risk and things like that. And so I think an important thing for us was making sure that we communicated, with our employees, about the risks and about what steps we were taking to prevent, or to prevent those risks. And then also to be flexible, like we've talked about before, with potential for working remotely when you can, and then also I think making sure that HR connects people with resources that might be available to help them, when they're in particular situations. If I know that for a while there, if somebody had to take off because of COVID illness or something like that, that now there's something through the state where they can actually get that time back. And so, making sure that people know about those resources, so that they don't have to take all their PTO because they got sick or their dad got sick or something like that. And so I think those are important steps as well.
I couldn't agree more. Isn't that the truth? Communication is key during this time, and especially from our HR departments who have all this great information about what are the benefits that our employees are entitled to during this time as well. But boy, communication is key. All right, let's switch gears a little bit here. When talking about children and adolescents, what do you think may be the long-term effects of the pandemic on our younger community?
I think we are seeing this a great amount within our pediatric population, and we have fabulous pediatricians who've taken care of generations of kids within TrueCare, and they're just as concerned as we are in behavioral health. I'm excited that the schools are recognizing this. You're seeing this a lot more, that schools are pushing more resources into providing mental health support and other resources for our young folks. I also just think recognizing that, this is a stressful time. I couldn't imagine in high school having this happen, to this age, being this age and seeing this happening. I think we as adult folks won't have this experience, and we won't have this. So we're going to learn from our young folks kind of how they need to be treated and how they want sensitive care given to them. I think they're going to teach us a lot, and we're going to be flexible and kind of learn from what we can do to support them and provide as many resources and judgment-free support. And it's a family thing. I think it's supporting the mom and the dad and the grandparents and everyone else who can help the whole unit, and just being sensitive that we might see that trauma and other things happening later on down the line that we didn't recognize because our kids are very resilient, and we're not going to be seeing this for years to come, and we just need to be sensitive to this for the rest of our lives.
Yeah, I would have to agree. I appreciate how you talked about, I appreciate how you talked about being sensitive. I think that's a big piece of it, being able to normalize the experience that the kids are having and not make assumptions, ask more questions than, making comments. I know there's, a lot of the teens right now are feeling like they're losing, they're losing maybe the opportunity to go to an in-person prom. They're losing the opportunity. A lot of the kids didn't get their last senior year to showcase their athletic abilities to be able to qualify for scholarships, or, be able to celebrate what would be a normal milestone for those of us who, went through our senior year and all that it was, how fun it was. Our kids have heard us talk about our high school experience. I know my kid grills me on my experience in high school. And so she has that to compare it to, and she wants similar experiences, and this was her junior year this year. So I'm really hoping she has somewhat of a normal experience and in her senior year, but there's a genuine feeling of loss, like they're missing out and they're not going to get it back. So I think we have to acknowledge those feelings, that they're real, but then also help them frame into maybe a hopeful experience. What could be, what can we do to make a more positive experience for them? I know there's a ton of isolation. Even some of the kids who've been afforded an opportunity to go back to school on a part-time basis, it's really only for modified hours, and they're not getting that socialization that they had before. So it's, it's very hard for them. And I think this is a time that we can help create that lift, less judgment, maybe more compassion. So thank you.
I'm really glad you mentioned that sense of loss, because I think that's something that we really have to take into account on various levels, what many of our children and students have missed out on in the past 14, 15 months. And it truly is a little bit of a grief period for them, for what they didn't experience.
I'm actually very concerned about our adolescents and our youth. The impact I see from COVID is going to be long lasting. We have to remember that while we kept everybody inside to prevent them from being exposed to COVID, they were exposed to a whole lot in their homes. They're with their parents quite frequently. And so we have to remember, if there was any trauma already going on within the home, intimate partner violence, any kind of child neglect or abuse, those things may have been heightened. And so there is a real concern when my clinicians are providing the therapy that they're really taking that into consideration. And likewise, the grief period. There's extensive grief. People have lost family members, their own parents, and children have, passed away from COVID as well. So I do see that the impact is going to be long-term and quite necessary for our mental health industry to pick up the pace.
I think that's such an important point that you just made of our kids being literally stuck at home with their families, and our mandated reporters typically being our school-based professionals, our teachers, our school nurses, our school counselors, who don't have eyes on the kids anymore, to be able to kind of say, hey, John, is something going on? Mary, is something going on in your home? Because we're just not seeing that anymore. And I do believe we will have some significant long-term impact of just trauma, and where we just haven't been able to recognize there may be issues going on in the home.
Yeah, exactly.
Yeah, I mean, I agree. I think I think we could be looking at in the long term increases in rates of PTSD potentially, from this time period. Who knows? But that's a possibility. But then, I also think that we talk about all the potential problems. I mean, I think there's potentially some positives in that. I think this will be a generation shaped by this event, and certainly, technology has just changed dramatically, over this time. And I know just looking at my kids, their skill and ability with technology and connecting virtually is beyond anything that I have any ability to do. And so I think this has supercharged that transition, and I think it could cause really interesting changes, as we move forward, as this generation, takes control of our country, and they're gonna have a totally different experience, when they were kids than we had. Similar to, we talk about the generation that lived through the recession, or the generation that lived through World War II and things like that. I think this is going to be at that level. This is a generation shaped by this event, I think.
Thank you, Dr. Rodarte, and thank you for looking at the positive as well. It's very easy to focus on the negative and the challenges that we've all experienced, but there are some positives that have come out of all this. So one final kind of broad question. What are your hopes for the future of the mental health of our community?
I hope certainly that we've learned lessons. I hope that we can, sort of take what we've seen and where we thought maybe something wasn't possible. I don't think any of us could foresee how quickly we needed to pivot and be able to provide care, crisis stabilization, everything that was provided in such a remote format so quickly. So where we thought maybe there wasn't flexibility, there certainly is. And we can learn from that. And we can, definitely grow from that is my hope. And I also hope that we become more compassionate, just a more compassionate caregiving workforce, and definitely at the leadership level. When our employees have to make a decision between caring for family or serving a client, both who need them, I mean, that is a very hard position to be in. And so I hope that we can celebrate them with events like this. We can recognize our healthcare heroes, and at the same time, just remember the individuals that they are. Just show up, be present, celebrate the wins. Not forget that this continuum of care is made up of individual people.
I'd like to add that I feel like sometimes mental health clinicians were hard on each other. And really, my hope is that we are compassionate and we're here for each other. We take care of each other. So when it does come to deciding on whether or not to take care of your family or your patient, please take care of yourself first. It's like that old adage, the oxygen mask on you. You have to be able to help others. So definitely agree with that.
And I think part of the future is to recognize the past, but also move forward and learn from the past and learn how we can do things better. I think if we know better, we're going to do better. And we're our tagline at TrueCare has been we're co-victorious through COVID. So we're pushing through it. We're going to keep going. I think our teams throughout the San Diego community and throughout all mental health care providers, I think they're all rock stars. We're all pushing forward and doing the best we can. And our goal is to see that keep going, see us keep improving mental health where, people don't have to suffer as much. That's our goal, is to limit the suffering of our populations.
Thank you.
And I guess I would just say, I hope that we can continue to work towards destigmatizing, behavioral health in general and services. 'Cause I think that's a big barrier that we need to just keep working on to improve on that and make it so that access to services is better. I think right now we just don't have the access that we need for behavioral health services. We need better parity. I know there's parity laws, but I don't think they're really being followed, to be frank, and I think that's such an important thing, that people have access to these types of services. And then I personally, I really hope that we can also move towards improvement in quality. I'm a primary care doctor as well, and I know in primary care we have so many quality measures we use, and then we always talk about in behavioral health, well, what measure are we going to use for this? And it's like pulling teeth trying to find a measure that's easy to use and that's been standardized across the people. And so really improving our quality measures, and then in general improving our treatments and our diagnostics. I think in behavioral health there's room to improve, in how we diagnose and in how we treat, and making sure that we treat things, use treatments that are going to work for particular conditions, and so have good ways to identify a diagnosis and then be able to use a treatment that we know will work for that diagnosis. I think we've got a long way to go in making sure that we're doing that effectively in behavioral health.
Thank you so much. Just a huge sense of gratitude from me personally to all of you here today and the work that you do, along with our healthcare heroes we're going to be talking with in just a little bit. But thank you for all you do every day, wrapping it up that decreasing stigma, increasing compassion and tolerance, and flexibility with one another and our clients and our families are all key to a future very poignant mental health and wellness as we move forward through these times, and we're kind of seeing a little bit of the light at the end of the tunnel. Well, that's all we have the time today for questions. Again, a huge thank you to today's panelists and sponsors for sharing your perspectives and giving us all such great insights on such an important and timely topic as mental health. As we always say, there's no health without mental health. Thank you so much. And now the San Diego Business Journal presents a salute to San Diego Healthcare Heroes Awards presentation. Each Healthcare Heroes sponsors have selected 5 deserving recipients within their organization who have gone above and beyond their respective fields. Each of today's senior leaders will present each of their honorees, and then each honoree will then have the opportunity to say a few words. Please help me welcome Kaiser Permanente's Senior Vice President and Area Manager, Jane Finley.
Thank you, Cathryn. I'm pleased to be here today to recognize 5 healthcare professionals whose leadership throughout the COVID-19 pandemic enabled Kaiser Permanente to respond quickly to the challenges posed by the virus and ensure our patients and our community had access to safe, quality healthcare. In the early days of COVID-19, there was a tremendous amount of uncertainty as the world responded to the pandemic. Even now, we are learning new information about the virus daily. Providing high-quality, compassionate healthcare during a constantly changing and evolving pandemic requires dedication, resiliency, and passion. I'm honored today to share with you 5 individuals who demonstrate those qualities and more. Our first honoree is Louise Liu, Area Pharmacy Director for Kaiser Permanente San Diego County. Louise redesigned and implemented home delivery prescriptions to Kaiser Permanente members to ensure patients received needed medications despite the disruptions caused by COVID-19. She also redesigned and implemented convenient prescription ordering and pickups for 19 Kaiser Permanente pharmacies across San Diego. Louise has overseen the process to safely and effectively deliver COVID-19 vaccines at 5 Kaiser Permanente locations throughout San Diego County, resulting in more than 350,000 vaccinations to date.
Thank you to the San Diego Business Journal for selecting me for the Healthcare Heroes Award. I am honored to accept this award on behalf of Kaiser Permanente and our pharmacy teams. I am truly grateful for the many amazing leaders, pharmacists, and staff, as well as physicians and nurses that I get to work with every day, and it is through our incredible partnership and teamwork that we are able to overcome many challenges, achieve new accomplishments, and deliver excellent care to our members and community during the COVID-19 pandemic. Thank you, everyone.
Our next honoree is Carrie Ford, Kaiser Permanente's Chief Nurse Executive. Carrie ensured high-quality, safe, and compassionate care for those providing nursing care and those receiving care at our 2 Kaiser Permanente hospitals during COVID-19. She designed and implemented safe, high-quality nursing care practices during the uncertain and changing demands of COVID-19, and worked tirelessly to support direct caregivers who dealt with the heavy demands of caring for COVID patients and their families during the pandemic.
Hi, I'm Carrie Ford, Chief Nurse Executive at Kaiser Permanente San Diego. Thank you so much for this recognition, and thank you to the San Diego Business Journal for recognizing our health professionals. It is my pleasure to accept this recognition on behalf of all Kaiser Permanente nurses and the nursing profession as a whole. It has been an extraordinary year, and although challenging at times, it has been an honor to work in a nursing leader capacity during this time. Our exemplary nursing care, delivered by our exceptional nursing team, was made possible by the outstanding leadership of Kaiser Permanente, from our senior leadership team to our nursing directors and managers and our support services. I am so proud to be a nurse, living my childhood dream every day and working alongside this wonderful dynamic nursing team caring for our inpatient members. It is so very meaningful to be recognized alongside all the other nominees, so again, a heartfelt thank you.
Tracy Abrams is our next honoree. Tracy is Assistant Medical Group Administrator and Chief Nursing Officer for Ambulatory Practice Services at Kaiser Permanente San Diego. Tracy led ambulatory care services strategy and tactics throughout the pandemic. She focused on education and training specific to the pandemic around care delivery, PPE, social distancing, and facility modifications. She is a member of Kaiser Permanente's COVID vaccination Tiger Team, who developed and led our COVID vaccination strategies. Tracy has developed and deployed internal employee health and safety surveillance programs to quickly address any COVID exposure concerns.
Hello, my name is Tracy Abrams. I'm an Assistant Medical Group Administrator and Chief Nursing Officer for Kaiser Permanente San Diego. I'd like to thank the San Diego Business Journal and the San Diego Kaiser Permanente Executive Leadership Team for this incredible honor. It's very humbling, and I'm moved beyond words, but I would be remiss if I didn't thank all of the men and women that it took to succeed this past year and a half. No one person was capable of accomplishing so much. than we all did working together. Thank you, Kaiser Permanente San Diego, the men and women who have served on the front lines, bending and adjusting to meet whatever came our way. This is an incredible honor, and I am forever grateful. Thank you.
Our next honoree, Eli Cueto, is Assistant Medical Group Administrator for Primary Care, Pediatric, and Urgent Care Services. Eli led primary care, pediatric, and urgent care strategy and tactics throughout the pandemic. He advanced Kaiser Permanente's virtual and remote care, as well as care delivery of in-person care at designated safe venues, for example, drive-through care sites. Eli led the redeployment of physicians and staff to manage the demand for virtual care. He also led the creation and deployment of Kaiser Permanente's COVID testing drive-through locations. Eli is a member of Kaiser Permanente's COVID vaccination Tiger Team and helped develop strategies for deployment of Kaiser Permanente's 5 vaccine centers across San Diego County.
Hello, my name is Eli Cueto, and I'm an Assistant Medical Group Administrator for Kaiser Permanente in San Diego, overseeing primary care services. I'd like to start by thanking the San Diego Business Journal for this recognition as a healthcare hero. I must say that I can't take credit at all for this award alone, as it's been truly a journey where all of our incredible teams have stepped up. Our physicians, our staff, and our leaders across all of our buildings in our medical centers have just done incredible work to take care of our patients and pivoted and shifted and adjusted and really changed what they do each and every day based on the needs throughout the pandemic. And so I do see this as a recognition for all of our teams and all of our people who have also given me great ideas and support and have helped us kind of get through one of the most difficult years of our lives. Thank you.
And our final honoree today is Dr. Will Singh, Assistant Area Medical Director and President of the Professional Staff for Kaiser Permanente San Diego. Dr. Singh's clinical and strategic leadership were essential to Kaiser Permanente's successful response to COVID-19. Dr. Singh has worked tirelessly with San Diego's chief medical officers and other community healthcare leaders to formulate and execute the effective response to the pandemic. Dr. Singh is the physician lead for Kaiser Permanente's patient safety initiatives and was instrumental in adapting patient safety protocols to address COVID. He is also the co-lead of Kaiser Permanente's COVID-19 vaccination Tiger Team.
Thank you for this honor. I want to accept this award on behalf of my colleagues and my fellow physicians. For my colleagues who were stricken by COVID and came right back to care for COVID patients after the recovery. For my colleagues who should be here with me but are still in the front lines battling COVID. For my colleagues who ran into the COVID ICU room prioritizing the patient's life over themselves and their family. Through the darkest hours, we were there. We showed up and we took care of our patients. We were there, caring for as many as we could. We did the best that we could. We were their last faces many saw before succumbing to the disease. We were their physician, we were their hope, we were their family. We were tired, we were exhausted. We didn't have time for our loved ones, and we kept going. We were quarantined from our wives. We were quarantined from our children. We are still fighting. We're hopeful. We are almost there. Let's do this together. Thank you.
Thank you, Jane. Next, please help me welcome Chief Operating Officer, Dr. Wendy Broughton from Mental Health Systems.
Thank you, Cathryn, and thank you to the San Diego Business Journal for hosting this event. I'm honored to represent Mental Health Systems. The tireless efforts of our employees over the last year has been truly remarkable, and it's an absolute pleasure to take part in this event focusing on mental health and to have the opportunity to recognize these amazing people at Mental Health Systems. Our first honoree is Delrina Swagger, Vice President. Delrina has an amazing, upbeat leadership style and was the absolute glue for everyone at the Convention Center temporary shelter. She facilitated an art therapy project for homeless that is now on mobile display traveling around the region. She truly is one of the most compassionate people I know and well deserving of this recognition.
Hi. Well, I'd like to start by thanking the Academy and, what's that? No. Okay, sorry, this is a busy award season. Sincerely, I'd like to thank the San Diego Business Journal for honoring healthcare heroes in our community, and I appreciate being an honoree. When I look back on my experience at the Convention Center, I remember getting the phone call about coming to the Convention Center to provide behavioral health services to up to 1,500 homeless residents, and I knew that it would be a special work and life experience. And a year later, it really had turned out to be that. And I oftentimes think about why that was the case. And the reason is because of the teamwork. Really, hundreds of heroes came together at a time when we didn't know what to expect with this virus, but that we all had the common goal to take care of those who were vulnerable and in need. And I'm talking about convention center staff, kitchen staff, the custodians, lifeguards and librarians and medical staff, nurses, shelter staff, etc. We all had this common goal, and so we became an immediate team. I remember some of our first times of going into isolation with someone who was positive for COVID and doing physical and behavioral health assessments, and us helping each other get dressed in gowns and multiple masks and gloves, etc. We were very supportive of each other, and we all loved what we were doing because we knew it was good work. It was comprehensive, it was coordinated, and it was positive. And in the end, it was one of the most satisfying experiences I've had in my career. So I'm appreciative of being asked to do it. And I'm also appreciative of the leadership in San Diego for breaking down typical barriers that normally exist when you bring together big organizations, multiple sectors, bureaucracies, and I feel like they did an outstanding job of providing us what we needed so that we could take care of the homeless. So thanks again, and thanks to all my fellow honorees.
Our second honoree is Randy McLean, Program Manager. Randy passionately guided the Courage to Call team at the Convention Center Counseling Corner, serving homeless veterans and aiding medical staff in triage and collaboration. She has courageous leadership and is deeply committed to the military space. Thank you, Randy.
Thank you so much for considering me as one of this year's honorees. The work we did at the Convention Center was truly a highlight of my career. We had an opportunity to help people when they needed it most. I am forever grateful I was able to be a part of this amazing collaborative effort in the Shelter to Home project. A special part of this year was working with our veterans. As a veteran myself, helping this community is especially rewarding. 2020 was a year of a global pandemic. It was amazing to see our community partners come together, reduce barriers, and increase access to care. Thank you to MHS and the San Diego Business Journal for nominating me.
Our next honoree is Veronica Aguilar, Program Manager. Veronica showed tireless oversight 7 days a week with interventions, crisis support, and medication management at the Convention Center. She linked more than 800 homeless people to MHS Storage Connect centers, keeping their belongings safe and secure. She is small, but she is mighty. Thank you, Veronica.
It is an honor to be named one of San Diego Business Journal's healthcare heroes. It is very satisfying to know that my contribution and service helped individuals during the pandemic. Thank you.
Our next honoree is Laura Linton, Dual Recovery Specialist. Laura is a powerhouse of endless enthusiasm, engaging Convention Center homeless and recovery groups. She coordinated 800 linkages to needed substance use disorder and mental health programs. She is an incredibly inspiring example. Thank you, Laura.
I want to thank the San Diego Business Journal for this honor. I am greatly humbled and amazed that I'm able to receive this award along with my other co-workers, Delrina, Laura, Randy, and Veronica. And I want to thank mental health systems, especially Wendy Broughton, for nominating me. It was my greatest pleasure and an amazing opportunity to provide the services that we did at the convention center. It was truly a collaborative effort that was amazing to watch and be part of. And I wouldn't have been able to do what I did without the amazing team that I was surrounded by. Thank you again.
And our final honoree is Dr. Laura Otis Miles, Senior Vice President. Laura has shown expert leadership demonstration at the Convention Center Homeless Shelter, collaborating with key partners from Behavioral Health Services and the Housing Commission. She is incredibly dedicated and what we like to call fondly, scary smart. Thank you, Laura, for everything you do.
I'm truly honored to be nominated as a healthcare hero. In San Diego, mental health systems stepped up to provide 24/7 behavioral health care for homeless clients residing at the San Diego Convention Center throughout the COVID-19 pandemic. My commitment and passion is to serve the most vulnerable clients and families facing serious mental illness and co-occurring substance abuse challenges. I'm so proud of our Convention Center Counseling Corner team. We provided 9,000 services and made 800 linkages for our clients to local mental health and substance use treatment programs. Thank you to the Mental Health Systems Executive Team, San Diego Business Journal, and my Convention Center leadership team, colleagues, Delrina Swagger, Randy McLean, Veronica Aguilar, and Laura Linton.
Thank you, Dr. Broughton. Next up, please welcome Dr. Rakesh Patel, CEO of Neighborhood Healthcare.
Thank you. I am privileged to be here today. I am Dr. Rakesh Patel, CEO of Neighborhood Healthcare. This past year, we have seen our staff go above and beyond to deliver quality healthcare to everyone, regardless of situation or circumstance. We are honored to recognize the following healthcare heroes for their continued dedication and service. We at Neighborhood honor Leslie Munoz, Director of Operations and Women's Health Services, in recognition of her work planning and executing the Neighborhood Healthcare COVID testing and vaccine rollouts. Leslie has worked many late nights and weekends planning and executing the mass COVID testing and vaccine rollouts. Her contributions have allowed us to vaccinate more than 30,000 people.
Hello, my name is Leslie Munoz, Director of Operations and Women's Health Services at Neighborhood Healthcare. I've been with the organization for almost 11 years, and wow, I am truly humbled to be recognized as a healthcare hero. This year has been extremely challenging for everyone, and it has been so wonderful to see our team at Neighborhood Healthcare come together for the betterment of the community. Although I, along with others, are being recognized as healthcare heroes, it is truly a team effort that requires our staff, our patients, and our communities to come together, especially during the last year. I am so thankful to be recognized today, and I am so thankful to be in such good company and look forward to continuing to serve our communities.
Neighborhood honors Dr. Zilma Curet for her response to provide clear, accurate information through her numerous appearances on TV news, as well as videos, while also continuing to provide care to her pediatric patients. Dr. Curet shares her knowledge and compassion to keep our communities healthy and happy.
Hello everyone, my name is Dr. Zilma Curet and I'm a pediatrician at Neighborhood Healthcare. I would firstly like to say thank you for the honor of being named as an honoree for the San Diego Business Journal's 2021 Healthcare Heroes Award. This was very unexpected. I was pleasantly surprised, to say the least, so I am truly humbled. As a native to North County, San Diego, growing up in an underserved community and having poor access to healthcare throughout my life, it is very important that I provide great medical care to any patient that walks through our clinic doors, regardless of their situation. With that being said, I served my community proudly this past year during such a difficult time with COVID and tried to ensure my patients and their families that we were going to get through this together. This past year presented many virtual visits that involved COVID education and a lot of emotional support of so much that was unknown at that time. up to seeing patients in our urgent care clinic with COVID symptoms and caring for them the best way possible. Although we've come a long way, there is still more to do, and I will continue to look forward to serving my patients and our communities. So again, thank you everyone for this honor and for all of those who made this happen. And I want to thank my husband and children for being so supportive during the pandemic when I was called to the line of duty to help and knowing the risks that were involved to help my patients. Thank you, San Diego.
At Neighborhood, we honor Wendy Vieira, our Director of Operations for Behavioral Health, for her continuous support and leadership to keep our behavioral health department running smoothly and efficiently in a time of increased need for mental health support. Wendy has been critical in responding to the needs of our patients and community, especially through our partnership with Interfaith.
I am honored and humbled to be recognized as a healthcare hero. There is nothing I do that is not supported by an incredibly competent, high-quality team. I am privileged to be working with such amazing individuals who give selflessly every day. At Neighborhood Healthcare, we live the ideal that we, the collective community that we're all a part of, is better together. To that end, we partner with community-based organizations so that we can all be an extension of each other to meet the complex healthcare and social needs of those we serve. Our team includes generous donors without which we could not provide many unfunded services. And finally, our team includes patients who put their trust and choice in Neighborhood Healthcare to improve their lives. On behalf of the incredible team of individuals I have the pleasure of directing each day and the role all of us play in being healthcare heroes, I thank you for this honor and recognition.
Neighborhood honors Michelle Hughes for her tireless work in community outreach to our patients to improve their health outcomes, especially for diabetes, and overcoming barriers in accessing care. Michelle's team has been also critical in maintaining our quality measure scores by contacting patients through text and phone calls to educate and schedule for COVID vaccinations.
Hello, my name is Michelle Hughes, and I'm the Director of Quality and Population Health at Neighborhood Healthcare. I'm both honored and humbled to receive this recognition from the San Diego Business Journal's Healthcare Heroes Awards. I was very surprised to receive the email for this award. Most of the work we do in quality is behind the scenes, improving processes, implementing programs, and figuring out ways to innovate to better take care of our patients and our community. I feel fortunate to be part of such a forward-thinking organization who, in the midst of the pandemic, has stayed committed to supporting our quality and innovation efforts. A few of the highlights over the last year that our teams have worked on include launching a mobile services program where medical assistants visited patients in their homes to perform lab draws and check vital signs. At these home visits, the patients were offered COVID testing and opportunity to connect with a provider via iPad to address any other health concerns. We have been conducting multiple pilots on how we can embed technology into our care delivery model, including remote patient monitoring and creating a virtual care team. We're also in the early discussions and planning of creating a diabetes center of excellence with the goals of preventing onset of diabetes for at-risk patients and preventing complications in our patients with diabetes. None of this work is done alone. It takes a village to rally behind our initiatives, which ultimately serve our mission of providing quality care regardless of situation or circumstance. When I think of all our healthcare heroes at Neighborhood, there are so many who are also deserving of this honor. I'd like to thank Jeff Glenn, our Chief Operations Officer, and the rest of Neighborhood's executive team for the support and guidance on our large initiatives. Elizabeth Almada, Director of Operations and Patient Navigation, and Dr. Melissa Bishop, Medical Director of Quality, who have mentored me through my transition to leadership in quality. I'd also like to thank everyone else at Neighborhood that I have worked closely with day to day and also on various projects. There are countless others to name, but they all make Neighborhood a place I love coming to work to every day. Lastly, I would like to thank my husband, Nick, for his unwavering support and giving me the space to chase all of my dreams in career and life.
Yesenia Granero is known for being patient, gentle, and kind. An example of her quality of her care is when she treated a homeless patient with low blood sugar. After she was able to dramatically improve the patient's blood sugar, she went above and beyond to secure food for the patient from a local church.
I would like to take this opportunity to thank Neighborhood Healthcare for honoring me with the San Diego Business Journal's 2021 Healthcare Heroes Award. Working with Neighborhood Healthcare during the pandemic was very scary and unpredictable. Things were constantly changing. We now had to wear surgical masks while in the clinic and sometimes a face shield. Rain or shine, we were all out there testing away, then going home to our families. The way we all came together as a team. No, as a family, and supporting one another was very humbling. While the grocery stores were running low on the essentials, so was I. One of my coworkers gave me toilet paper, and another one gave me a bag of lentils. I was very thankful, even though the toilet paper was pink. Patient health care and our safety has always been a priority to all. We have such a great staff that came together as a team to support the needs of our community, patients, and each other. Neighborhood Healthcare developed a system to reach out to our patients via telehealth and offer mobile lab services to assure patients' healthcare needs were met. Neighborhood Healthcare had a Friends and COVID Day and offered the COVID vaccine. I have a few friends who are veterans with chronic illness, and they just could not find a place to get the vaccine. Thanks to Neighborhood Healthcare, they were able to get the vaccine without any hesitations. My friends were so impressed on how well and smooth everything was coordinated, and how wonderful and professional the staff was. I would like to extend this award to all of my coworkers, especially Miriam, medical assistants, doctors, Rebecca, PSRs, nurses, phone operators, lab technicians, and managers, and the refill center, of course. This award is for all of us. We all work very hard to make sure our patients' healthcare needs are met. Thank you for allowing me to be part of your family.
Thank you, Dr. Patel. And now, please welcome our final presenter, President and CEO, Michelle Gonzalez from TrueCare.
It's no secret the healthcare industry was pushed harder than ever before due to COVID-19. TrueCare's healthcare heroes showed compassion and courage as we worked diligently to keep our patients and our employees safe and well during the pandemic. It's for this reason that I'm so pleased to share our 5 honorees. Our first honoree is Cheryl McMahon, Director of Community Engagement. Cheryl demonstrated incredible commitment to our communities in 2020. With her leadership, TrueCare distributed more than 446,000 pounds of food to patients and community members. Her efforts assured that during some of the darkest moments of the pandemic, families had sufficient food and peace of mind. Cheryl is well known not only because she is well connected, but because she is a compassionate connector.
Thank you, Michelle, for this honor in being recognized as a healthcare hero. My goal and passion is to always serve our community by any way possible. At TrueCare, our mission is to support our patients and community members in and beyond our health centers. I'd also like to take a moment to thank my family and my son for their love and support over the last year. Thank you.
I'm happy to share with you that our next TrueCare honoree is Eileen Sapinos, Director of Nursing. For Eileen, being a caretaker for others is more than a calling. It's actually part of her DNA. Working in tandem with our administrative and clinical teams throughout the pandemic, she was a vital link to information and education for patients and staff. She embodies the notion that caring is the essence of nursing. And at TrueCare, it's important that we have the best, and that's why we have Eileen.
Good afternoon. I am honored and humbled at this recognition. I can really only be considered a healthcare hero because I work with Wonder Women and Supermen every day. They wear letters like RN, LVN, MD, NP, MA, and MR next to their names, just to name a few. I can't forget our CEO and CMO, who lead the way and inspire us all to do great work. I share this recognition with them all. Thank you.
Our second healthcare hero honoree is Dr. Devarshi Nath. Dr. Nath is a man of tremendous devotion and bravery. Throughout the pandemic, he remained on the front lines, nearly every day to serve our patients directly, often putting himself at risk to care for our most vulnerable. Dr. Nath, you have demonstrated your ability to face any crisis, and you are a true inspiration.
I'm deeply grateful to have been chosen for this recognition. I'm humbled to be included with so many wonderful San Diego physicians. I work for an organization called TrueCare. TrueCare, the name says a lot about it. Our mission includes taking care of the most vulnerable members of society, people who are already suffering from disparities in health and income, and bore much of the brunt of the COVID pandemic. Many are essential workers, vital to business and the overall economy. At TrueCare, we've been blessed with leadership, with vision, and staff that understand and are dedicated to the mission. The pandemic has opened everyone's eyes to the idea that things like this can actually happen. Many had predicted it was just a matter of when and not if. Hopefully, there are lessons to be learned from all of this. We don't know what those lessons are yet, but there is this one basic one. Leadership based on science and compassion will always be better able to deal with pandemics than denialism, inflamed passions, and division. The examples of South Korea and New Zealand show us that it can be done. Make no mistake, this could have been a lot worse. Imagine a higher death rate or worse outcomes in kids. We can't afford to be complacent next time. Hopefully it doesn't happen again for a long, long time, and hopefully humans will be more technologically prepared. After all, during the last big pandemic in 1918, viruses were still theoretical. Electron microscopes hadn't been invented yet. DNA and RNA were unknown. I thank my colleagues at TrueCare for their hard work and dedication. I'd also like to thank my wife and kids for being my strength and inspiration through all of this. Finally, I'd like to thank the San Diego Business Journal. I grew up on the East Coast, educated at Johns Hopkins and the University of Connecticut, and I've lived from Massachusetts in the east to Hawaii in the west. But there's no place like San Diego. This is the place where my kids were born and are being raised, and this is the place that has defined me. Thank you.
I'm proud to share our next healthcare hero is Andrea Lewiston, Chief Human Resources Officer. Andrea is the epitome of a courageous advocate, consistently keeping her eye on the best interests and needs of our workforce. She understood and embraced the belief that by prioritizing the TrueCare team, we were in essence prioritizing our patients and our communities. She's never lost sight of the fact that our staff are humans before they are resources, and that the best leaders must first become even better servants.
First, I want to say I'm honored to be nominated as a healthcare hero. I feel like this award really goes to each and every employee at TrueCare, both staff and providers. In the midst of true fear and uncertainty, our employees did not hesitate. They didn't hesitate to take care of our patients or look out for each other. They showed up and they did their best. And I think a true silver lining out of this horrible pandemic is 100% this teamwork that shows resilience in the face of fear and compassion in the face of angst. A heartfelt thank you to all of our staff and providers.
And I'm pleased to share that our final healthcare hero is Dr. Marie Russell, Chief Medical Officer and Chief Operations Officer. Dr. Russell joined the TrueCare team at the height of the pandemic and quickly rose to every call of duty. From the onset, she has demonstrated a steady, unwavering, and authentic commitment to assist everyone around her to be their best. She understood the need and the power in mobilizing many in order to battle COVID. Dr. Russell is effective, yet humble, and consistently demonstrates that being a hero is never about a title, but instead always about the actions.
Thank you, Michelle, for your nomination, support, and kind words. I'm deeply honored to be recognized today as a healthcare hero. Though this past year has been unlike anything we've ever seen, we all know there's so many of us at TrueCare that work to provide quality, compassionate care. And to be recognized as a hero is inspiring. We are united in our goal to continue to provide health for all, and I'm honored to work toward this each day. Congratulations to all those recognized, and thank you again for the recognition and honor of being a healthcare hero.
I want to thank everybody today, our panelists and our sponsors, and especially our Healthcare Hero awardees. It has been such an honor for me to be here and moderating this event. Your compassion, your dedication is so inspiring to all of us in maintaining and providing for the mental health of our community. And a big thank you to San Diego Business Journal for including me in this timely and informative event. It was such a pleasure being here, and I thank you so much.
Congratulations to all of our healthcare heroes for their well-deserved recognition. This concludes our program. Again, we'd like to thank our sponsors, Cathryn, and all of the panelists who have given us incredible insight regarding these important issues. I would also like to remind everybody that you can read more about all of our honorees in our print and digital editions. And additionally, this entire event will be available on our website, sdbj.com. Thank you for attending.